Good morning. My name is Nanaya Opiahini, and this morning I'm going to be talking about analyzing the healthcare environment with a focus on Geisinger Health Systems. Geisinger Health System has 189 locations, which includes hospital, clinics, specialists, and PCPs. They serve about 1.5 million patients, and they're primarily located in central Pennsylvania, but with locations in eastern Pennsylvania and New Jersey. Geisinger has its own healthcare plan called Proven Care or insurance plan, and it's a fixed price bundled payment system. Also, some of the things or medical centers for Geisinger is a Danville Center, which is the largest, and it's a primary tertiary care level 1 trauma center. Children's Hospital, it employs 551 physicians. It's a research facility and a teaching hospital. Geisinger was founded more than 100 years ago by the Geisinger family. In 2017, the larger hospitals reported greater margins, with the Danville Hospital bringing in about 1.1 billion in revenue, which was 12.06 profit margin. And on the reverse side, the community hospitals or the rural hospitals didn't do so well. The Bloomsburg Community Medical Center brought in 42 million in revenue, but had a 48 million in operating expenses, and that was a 7.92 loss for the year. Also, in addition, there was a high rate of uncompensated care, which was about 2.44%, and this led to some other community or rural medical centers suffering losses. When we look at the PESTEL analysis, politically, if the Obamacare is replaced, this could increase Pennsylvania's uninsured population. Economically, low incomes and household spending that is relatively higher than the incomes made could increase debt. We look at our social aspect, where you have an older population and low diversity. It's really hard to create any infrastructure. Looking at the technology aspect of it, Geisinger has the state-of-the-art research facilities and techniques, which is a plus to help, keep the environment or keep the community in good health and in good spirits. Legally, the Rural Emergency Acute Care Hospital Act could help Geisinger's low-performing hospitals with subsidies, and this is something that we're going to discuss more on. When we look at the environmental aspect, many rural hospitals in the U.S. are in danger of closing because of the low PCP to patient ratios, and we're going to discuss that in further detail. On this slide, this talks about, this also indicates about 75% of rural hospitals have been closing because of the coverage gap. There are about 1 in 6 rural hospitals that are vulnerable to closure. We're going to look at the some evidence-based strategies to help address keeping Geisinger going. And one of the biggest issues, as you can see from this chart here, is the primary care physician to patient ratio. And in the United States, it's about 1,030 to 1. But if you look at counties like Mifflin, which has about 21 primary care physicians, the PCP ratio is about 22 2,210 patients to one physician, which is kind of above what the median average is. So one of the takeaways from this slide is that Geisinger's first strategy is to add additional primary care physicians to the areas that need it to help, bridge the gap. Some of the ways to addressing this is utilizing lobbyists to propose state and federal incentive plans for medical students to become rural patient care physicians. Also provide internal incentive for patient care PCPs working in underserved areas. Another area to look at for evidence-based strategy is, as we talked about earlier, using the new Rural Emergency Acute Care Hospital Act, which could be able to provide support to locations that do not meet the high demand, or the centers that are not being able to produce enough profit margins, because if Geisinger is able to leverage the new Rural Emergency Acute Care Hospital Act to provide assistance to its rural locations and maintain the care that is currently provided to these small communities, then these locations will not have to close. This slide goes ahead to indicate, as we talked about earlier, leveraging the benefits from the Rural Emergency Acute Care Hospital Act, which will provide federal aid for private rural hospitals. And Geisinger should review the details of the proposed act and make appropriate changes to ensure that its facilities can benefit from these subsidies. Third evidence-based strategy is reducing medical mistakes. From this chart, you can tell some of the medical errors that have led to high deaths and heart disease, cancer. Medical errors are some of the top priorities. And so the best way Geisinger can mitigate this is to assess administrative mistakes and design a plan to reduce the number of mistakes that the hospital is responsible for. This strategy will not only save lives and help to increase hospital profits, but will also create a better reputation for Geisinger, helping the system expand and gain new patients in the future. And some of the steps to be taken to reduce medical mistakes are retraining administrative staff, provide mentors for new employees, utilize third-party audits, monitor vulnerable populations, and provide English translations as needed. And also, collaboration and communication should be encouraged as a way to help improve the rate of mistakes for the entire team. In conclusion, the Geisinger Health System is relied on to support the health of Central Pennsylvania community members. As a well-established and recognized health provider, Geisinger has a responsibility to continue to improve the health of community by targeting specific health-related issues. Currently, these include low PCP to patient ratio, rural hospitals with negative profit margins, and medical mistakes. By utilizing evidence-based strategies, Geisinger can target these issues and make a positive difference in the health and well-being of Central Pennsylvanians. This concludes my presentation. Here are the references. Thank you.